Okay, is this everybody? Let's go ahead and get started, okay? First things first, okay. If you worked last night, then you know we had an extra nurse and we forgot to call anybody and tell them about her. So tonight, to make up for that, they're taking away 2 nurses. Thank you. Okay, so we've got a new policy. If you hadn't read it, it's in the bathroom. It says that effective immediately, all staff must leave their cell phones on and make themselves available when not on shift. Consider yourself on call, and you must answer all calls from Gary. And if you are asked to cover a shift, you must do so without complaints. This is not optional. We all need to work together to help the company succeed. Let's set some record profits this quarter. Go team. See? Right in the bathroom. Okay, you got to answer that Gary call. Thank you. All right, let's go ahead and go to the suggestion box. This one says, if you have one of those IV pumps that just won't stop beeping all night, or if the IV is positional or the patient's sleeping on that arm, the easiest way I've found to stop the IV pump from beeping is to turn it off until 7 a.m. Okay, thank you. All right, you guys have a great shift. Just know that we might need a couple of you to stay a little bit late tomorrow because as of right now, we have no nurses scheduled to come in and relieve us. Okay, is this everybody? Let's go ahead and get started, okay? First things first. Okay, you probably all got an inbox saying that you have e-learnings due. That's because you all have e-learnings due. No one has completed them yet. They're all due by midnight. Thank you. Let's read some of our more positive patient satisfaction surveys that we got. The first one is for Larry. It says, Larry is super cool. He always gave me my pain pill and my pain shot at the same time. Good job, Larry. This one is for Sarah. It says, when Sarah came in my room, I thought it was a joke. I could not believe that one person could have that much dog hair on them without knowing it. Before Sarah came in my room, I was not allergic to dogs. I am now. I feel bad for Sarah's dogs at home because they must be freezing because she wore all their hair to work. But she was super sweet and she always helped me find the Hallmark Channel. Good job, Sarah. Good job, everybody. Thank you. Let's go to the suggestion box. This one says that if you forget to clock out for lunch, then you can basically take as long as you want. Yeah, that holds up. Okay, you guys have a great shift. Just know that one of those 3 patients that they just brought from the ER has tuberculosis, but they can't remember which one. Okay, is this everybody? Let's go ahead and get started, okay? First things first, wound documentation, okay? I guess we've missed a couple recently. Just remember that if we don't document a wound within the first 24 hours of admission, then that wound falls on the hospital, okay? So right now, the wound care team, they're going around, they're finding the high-risk patients, and they're slapping stickers on their butt cracks, okay? And so we have to turn our patients, and if we don't, and we don't find those stickers within the first 24 hours, then we can get written up, okay? And that's a real thing that hospitals do. Also, if you are documenting a wound, make sure it's actually a wound, okay? A couple weeks ago, Larry, he documented 2 nights in a row that this lady had a coccyx wound, and it turned out she had just rolled over and got a bunch of sandwich meat all crammed up in the top of her butt crack. Thank you. Okay, so we've got some students with us here tonight. Thank you guys for being here. If anybody wants to have one follow you around, you know, it's just free labor. They'll do all the stuff you don't want to do. Thanks again for being here, guys. Just remember, this is real nursing, okay? This isn't school. We get dirty and we recap needles all the time. Thank you. Okay, so you guys might have already heard, but Janet is no longer our acting manager. Some of the other leadership, the director, they all said that we were doing much better with no manager than we were whenever Janet was our manager. Okay, So thank you. Let's go to the suggestion box. This one says, remember, the bathroom right next to the nurse's station is for number 1 only. Yes, that is true. Okay, there's a gap like this big underneath the door. We can hear and smell and, see everything. We can see your shadow under there, okay? Okay, you guys have a great shift. Just know that we are basically out of gloves, so everybody gets 1 pair. You just put them on, wear them all night, and just wash them like they're your hands.